My name is Petrina McGrath, and I'm the Vice President of Quality and Interprofessional Practice at Saskatoon Health Region. And why I agreed to be on this panel goes back to probably about the third week I arrived at Saskatoon Health Region. I was asked to speak with a family member from our client reps because she was having trouble managing this family member, being with that family member, and she said, "I need your help. I can't do this. It's spinning out. We're not doing well." Is the way she talked. So I made an appointment to meet with this family member, and this family member told me about an incident a few months before, where we had in our care severely harmed one of her family members. And she explained to me what had happened from when that moment happened till 3 months, or almost 2 months, I guess, later. And she had seen some of the things that had come out of our review, and she had them in front of her, and she showed them to me. And she said, "Can you tell me this is going to make sure that this doesn't happen to another family?" And I looked at her, and I looked at the recommendations, and I said, "I can't, because they weren't going to change our system." And so that has been kind of why this panel is important, why my work with Heather is important, and why our work in the system around this work is important.
I'm Heather Thiessen. I'm a patient advisor in the Saskatoon Health Region. I said yes to this panel. Being a patient who's been in and out for many years, patient safety is vital. I've had many incidences where my safety has been compromised, and it's until you get those patients empowered and part of the team, you won't go anywhere. So by incorporating those patients and families, you will have better safety in the hospitals. I suffer from multiple sclerosis and myasthenia gravis. I also deal with multiple food and drug allergies. And to top it all off, I have a severe life-threatening latex allergy. So if life wasn't easy enough with my illnesses, topping all that on top just added a new dimension of when it came to my safety in the hospital. I've encountered numerous times when my safety has been compromised in the hospital, and probably is why today I have a reputation in the hospital of being that latex lady, or that lady is the one who asks all the questions and goes over everything again and again and again. And I have learned that through many health errors, that if I don't speak up and ask to be a partner in my safety, I may not go home. In early 2000, it was in my early days of being diagnosed with all these things together. And I was in the emergency room and had a myasthenic crisis, so I had to have a central line put in. So we had the central line put in, and the doctor ordered heparin to be put in the line to keep it open. But it was forgotten about my latex allergy, and they went through the rubber stopper to drop the heparin, which was normal for what you do with everybody. But in my case, we had to take it off, and that was forgotten. So I began to react, and they were like, "Why is she reacting? So we better give her Benadryl." So we got the Benadryl out, and we went through the rubber stopper again, not thinking, maybe we should take that off as well. And when my reaction got worse and worse, I still can see the resident looking down on me going, "It'll be okay, Heather," as I was going into anaphylactic shock. And it was at that point they realized, oh my God, we forgot to take off the rubber stoppers. And I was saved, so which is good. But from that point on, I became very paranoid. and determine that I stay safe. So I questioned and I questioned, and I double-checked everything, and I'm sure I drove every nurse crazy in intensive care, but I was so terrified that somebody would forget, because people would challenge my allergies and say, oh, you really don't have an allergy. And I got tired of saying, do you want to find out? Because it's not pretty. And even recently, and this is my other experience, I have many I could tell you, but we don't have enough time, unfortunately. And it was just probably a year ago, I was in the emergency room and I had a central line infection. I have a terrible time with my lines. And I had to go to the emergency room to get some antibiotics. So we have a protocol. I am also allergic to the preloaded syringes, and don't ask me why, but I am. So we can't use preloaded syringes. We have to make sure the lid is off the Benadryl. Even though it says latex-free, I am now reacting to other rubbers, so we have to take that off as well. We have to make sure pharmacy knows that I get a latex-free antibiotic. So when the nurse came in, I explained, and I'm very nice, I explained, we can't do this, we can't do this, we need to do this. And she left the room and came back. She came back with the Benadryl in a preloaded syringe. She came back with the antibiotic, and she proceeded to start getting ready to administer these things. And I questioned her on everything. I said, did you drop the Benadryl? Like, usually we do it in front of me because I'm just that crazy. And she said, I did everything you said. And I said, what about the antibiotic? I don't see latex-free on it. It's fine. You'll be fine. And I said, I don't believe you. And with that, she grabbed everything, ran out and got out of the room, and I never saw her again. And I broke down in tears because I thought, I have made someone very angry with me. And then my savior came in, and it was a nurse I had dealt with from ICU. And she said, well, Heather, you're back again. And she knew exactly what to do. She left the room, came back. She drew up the saline from an IV bag right in front of me. She popped the top to the Benadryl and drew up the Benadryl in front of me. She drew up the antibiotic in front of me because she says, we don't want to waste time going through pharmacy. We can do it right here in front of you. And I was out, and she said, dry away those tears. That woman doesn't get it. And I left on a better note, which was good because I thought I was going to be in ICU if I did not speak up and fight for my right. So patients know when they are right. We're not here to question the care, your expertise, but we do question when it comes to our safety. So that is why I get involved, and I speak up, and I get involved in our PIWs and incorporating the patient voice, because that's the missing link that has been missing in the years past, is asking what is there for patients.
Well, and it's so hard because who gets taught in school or during their residency or anything of the sort that there are people like this who have constellations of odd symptoms, and sometimes you just have to listen to them. I've heard so many clinicians discuss, well, all right, the eyes roll, and yeah, and I'm also allergic to milk on the 12th of the month, but not on the 17th, and yet, you know, my primary physician says, speaking of himself, he says, I'm an expert in medicine, but you're the one who lives with your body, right? And so wow, thank you, and you explained it so clearly. You know, and how do we teach every clinician to be attuned to the possibility? And yes, I know there are crazy people out there. How do you teach people to sense this? Petrina?
So some of the things that you hear in Heather's story and also in Donna's is this knowledge, this knowledge that patients and families have about themselves and about their loved ones. And you know, we're a knowledge organization. We're like, physicians have knowledge, nurses have knowledge, we all have knowledge. But somehow we don't actually hold in the same way the knowledge and expertise of the patient and family. And I think what we've learned more and more as I've worked together with Heather and many others, is that knowledge is so valuable. And without it, we will not get to where we need to go. The things I also want to pick up on Jerry's is around the vulnerability. Because there's a couple things around how we deal with vulnerability, I think. I don't believe anybody goes into healthcare to do harm. There's nobody that ever does. But our system is set up in many ways over many years to create this sense of vulnerability in individuals. And so what people do when they're vulnerable is they point fingers or they protect themselves. So even things, when I told you about the story of the family member who came and met with me and told me their story and asked if I could make this. When I first said I was meeting with that family member with some of my colleagues, they were like, well, are you sure, you know, we need to go right to the patient and because they might not, you know, maybe they don't have consent and maybe they don't. And the more and more I've engaged with this family member, I realized that the patient does not have the energy to continue to fight the system. And actually, if this family member wouldn't continue to challenge me and challenge our system, they would have just got tired and just let it go, because they can't maintain their own health and keep challenging the system at the same time if they don't have somebody that will do that for them. And every interaction I have with both Heather and with others, I learn more about what's not working in our system and where the opportunities are, because it's another lens. And I think Helen talked earlier about the diversity. When you're trying to put a team together, that it's that diversity of lenses and diversity of ideas that actually make the innovations and the solutions. And I think that diversity is, we can't have that if we don't have the knowledge and expertise of the patient and families. So Heather and I are both working at our region around this safety alert system, Stop the Line. And it is about a process, but it's really about changing the culture, because we can put a process in place. But if you actually don't create a culture where people feel safe to stop the line, to put their hand up, to speak up like Heather did, but also as a nurse or a physician or anybody else or a housekeeper, if we can't get to a place where somebody can say, I'm worried, this doesn't feel right, and we listen, we'll never get to that place of doing no harm. So I think one of the things around creating a safety alert system, Stop the Line, is that you have to have the diversity of the people. And Helen's presentation was so amazing because, you know, we've been talking, we did one rapid process improvement event, and it was so exciting because we had our board chair, Jim, we had Heather, we had ward aide, we had a nurse, we had a physiotherapist, we had a director, and we had a vice president. And together that team worked together. To me, that is just a gift because everyone has a different view. And we had Bonnie, sorry Bonnie. So outside eyes, and she provided outside eyes. So that was such a gift because it is that diversity of lenses that help us. And the other thing we learned is that people don't actually recognize safety risks. So part of it is for us to even actually recognize when there's something that's a risk for me as an individual or a risk for a patient and family. We actually don't have that lens, and it's not necessarily how we look. So I think the work, we're just at the beginning, but the only way that work will be really meaningful and change our system is if we partner as equals in bringing everybody's knowledge together, and Heather's been so critical to that.
It's been important as a patient to be involved. The one thing I notice is that everybody does leave their professional hat outside, and you do come together to talk about a common problem. And you're so, you're engaged. We made a safety box for patients on the ward that we worked on, to put, so they could be part of it if they saw safety issues as well, to be able to put things in. And where would you have seen that before? And I think they see a lot of safety issues probably sooner than the staff might. My husband will know when I'm going downhill sooner than a nurse might, because he's with me and he knows the signs. And he has been my voice many times throughout my journey and sticking up for me. But there's been many times in the past he's been shooed away because he has interrupted. And I talked about that last year at the summit, where he was asked to be removed from the emergency room because the doctor didn't like him interfering, and I'm left alone to battle myself, and that should never happen. So I will fight till my end. I can't make things better for me for my past, but my healing is from what we can do hereafter.
The other thing, just to build from Heather, in mine and Heather's discussions and with many, is that when we've gone back to look at incidents that have happened or safety happened, what I found, and I'll go back to the incident I talked about, when we went back and re-looked at that and talked to the staff involved, we had nurses that broke down and cried. And they had been holding this for so long. So when we talk about the safety, we also are victimizing our own caregivers in how we do things. So really, again, if I'm holding that and I have not been able to process that and heal, as Heather talks about her healing, how do I come to work every day and be at my best and be in this? So, there's lots of that shared purpose to me, and that shared caring for all is so critical.
A lot of what can cause these disasters is invisible, and clinicians work in this world all the time. And is there some way, some place we can stand and look at this and realize this is dangerous work, and yet we have this cultural myth of impossible perfection? And is there some way that we can welcome, perhaps we view the family member as like the ultimate specialist sensor attached to that patient, and when that sensor is raising an alarm, we listen. So thank you so much, and thanks to you and patients out there. What you should take away from this, to follow my own advice, is it is your job to speak up in clinical settings and teach other patients that they have every right, and it's reasonable, and it's no insult to the doctors and nurses. In fact, you might save them from going through a tragedy. Thanks so much.